Hey everybody, welcome back to Dental Unfiltered. I'm Matt Brown here with my normal co-host, Dr. Andrew Vallo. We have a super exciting episode for you guys today. Becoming the dentist, dentistry's Ritz-Carlton. There's places that we frequent, and that when we travel, we use the same place all the time, same airline, same hotel. For whatever reason, we do it, and the reason why we do it is there's a level of consistency of experience that we've learned to expect that gets delivered, and we know it's going to happen, and that certainty of that enjoyment makes us keep coming back. And Andrew has done a really good job of this with his practices of creating this consistency of experience. And I think a lot of practices, in my experience, have these comfort items they deploy. And I go to a practice in the morning and I'll watch the practice and they'll have warm blankets or embroidered blankets. I won't see them come out at all. And I'll ask them at lunch, like, why didn't you guys use them? They'll say, oh, no one asked. Well, the real reality is you have to create a consistency of patient experience, and it's your job to maintain and create that experience. And if you wait for the patient to create their own experience from asking for these items or reading off of a menu, what you're going to get is inconsistent experience and inconsistent patient retention. So he's put so much into this. I think when he was opening his first practice, we spent a lot of time together, and I think he's probably put most of his brain on what is it like from click to checkout for a patient in his practice, and how is he going to maintain it? When I say it's probably a big portion of his growth, it had to have been. So, Andrew, becoming dentistry's Ritz-Carlton, one, how important was that to you? Like, you recognize that, like, patient experience and consumer behavior was everything. So, one, how did you recognize how important it was? And then how did you approach it? Because you approached it very well.
Thanks, Matt. Hey guys, yeah, this is I think all of our episodes are important, but I think this one is exceptionally important. And I'll kind of start off by the common saying of people may not remember what you say, but they will remember how you made them feel. And I think that is all about what customer service is. How are you making your patients feel? Are you making them feel welcome? Are you making them feel important? Are you making them feel like their time is valuable? So there's a lot of different connotations that go in. Are you making them feel heard? And so the reason that I picked Ritz-Carlton is, I think that they take customer service to another level. And I think that's why that hotel is so popular. Because, I'll be honest, guys, I think the amenities can be a nice touch. But, I stayed at the Ritz-Carlton in Central Park when I was up in New York for the 40 Dentists Under 40 thing that I was selected for. And it was the best hotel experience I've ever had. And the hotel itself, I mean, from the outside, the hotel looked nice. The lobby was nice. The room was nice enough, but it wasn't the nicest looking hotel I've ever stayed at. It wasn't the nicest room I've ever stayed in. The amenities were honestly kind of lacking. The fitness center was smaller. They didn't have a pool, hot tub, sauna, anything like that. So, I do think amenities are a nice touch, but at the end of the day, the way that the employees, the way that the team members treat you and the way that they make you feel is everything. And so, I guess, picture this. You pull up to the hotel in your Uber, the doorman out front comes out, opens the door, big smile. Hey, welcome to the Ritz-Carlton Central Park. Grabs your bags out of the back. There's another doorman there opening the door for you, directing you to the reception desk. You walk up to the reception desk. Again, you're greeted, welcome to the Ritz-Carlton Central Park. As you're checking in, they're asking you things like, how was your travel here? If you had put any notes on the reservation, you're celebrating something, they're bringing that up. All these little touch points are really important to them, and they want to make you feel like you are important right from the second that you show up at their door. My wife had a crinkled water bottle in her hand. Here, let me take that for you. Like, let me dispose of that. Would you like some more water? Would you like some to drink while we're checking you in? So, just things that you normally don't encounter when you check into your average hotel. And they were all like really, really little things, but like they made such the difference. The bellman had grabbed the bags, and by the time we got up to the room, he was already waiting outside with the bags for us. We go inside the room, and he's giving us a quick tour of the room and talking about some of the history of the hotel. Before he leaves, he lets us know, hey, if you need absolutely anything to make your stay more comfortable, please let me know. That's what I'm here for. And then, the next morning I'm grabbing coffee, and you walk up to the door. I've got 2 coffees in my hand. Not only does the doorman open the door for me, but he follows me to the elevator, steps inside, and says, "What floor are you going to?" and presses that floor for me, so I don't have to juggle my coffees to get up to the room. Guys, I don't think anything I just said here was earth shattering. I don't think anything I just said here,
Oh,
were things that your team members can't be doing for your patients. But I think honestly, like I feel like the bar for customer service is set pretty low these days. So, just some of those things I just talked about were enough to wow me, at this hotel. And I think the bar is set even lower in the healthcare industry.
it's set so low in dentistry. The bar is the basement. Like, I think the problem, and the doc's listening to this, right? You know, it's one thing to create a customer service experience. It's another thing to create it consistently and deploy it and action on it, right? So this is a subject that, like, I bet I'm on 1 hour video calls about this subject probably 6 times a week, right? And when I go to a practice to visit in person, in the morning, I start watching the experience. I'll take a staff member, like, one at a time. I'll pull them aside. Like they're walking in the hall, there's an empty op. I'll say, "Come here. Look, can you just explain to me real quick what is the standard of patient experience here?" And they'll tell me something. Then I'll take the next staff member, the next one. And each one will have a completely different answer for what the standard of patient experience is. And then I know there's no organization in the way things are happening. Everything's happening completely randomly. So, Doc, if you're listening, ask yourself this question. If I was in your practice and I took your staff one at a time into an office and said, "Tell me the standard of patient experience," would I get the same answer or very different answers? If in your head you say very different answers, this is a place of great improvement for you. And it's a place that's great improvement that doesn't cost you any money, really, right? So when I find this scenario, the first thing I tell docs to do is this: have a meeting with your team, sit down, and craft a document of what is the patient experience in my practice, and have the whole team on it and have everyone's buy-in. When I say craft, don't just write it down. When you say the word craft, it's like you're making a piece of furniture with love. Do it with the spirit of making it. Now the question becomes, so now we make this document. It exists. Big deal. That's step one. Doesn't mean you're good at it yet. What I then say is, how often do you role play from check-in to checkout? And they say never. Role play from check-in to checkout once a month, twice a month, once a week. It can't cost you anything. Now, no one ever wants to role play. No one does, right? What happens, you take a dental assistant, you say, "Hey, you role play being a patient." And they're in their heads, like, I can be a dental assistant. I'm hardly ever a patient. So the way I tell them to make it fun is this. Every dental practice, right? If I asked you, "Do you remember the patient that acted like a jackass last week?" And they'll say, "Oh, yeah, the lady with blue hair came in, tried to bring her cat in. She was crazy." There's somebody, right? Have that dental assistant role play that crazy person that everyone remembers. Now make it fun. And role play the experience from check in to check out on some frequency to just practice and create that consistency. So what I'll guarantee you is Ritz-Carlton, all these organizations have some level of rehearsal or check on quality or something in place. So it's one thing to say, we have created a good patient experience, whatever. It's another thing to say that we're actually good at it. That's completely different. It's like, are we good at it? I personally, this isn't a thing in dental. I think it should be. I think that a great place in dental for improvement would be to have secret shoppers who come through and secret shop these things and give reports to the owners. I think that would be awesome. I think it's really good. But I believe in creating a document that is the standard of patient experience and then role playing on some level of frequency, check in to check out, handoffs, deploying water, deploying comfort blankets, turning on the TV, offering them the show they want to watch, offering them warmed hot towels, making sure the scent machine is working. I just bought scent machines for my practice 3 months ago. I got them a 3 month supply of scent. I'm going to go visit next month. It should be out of scent. I'll know if they took the initiative and bought more scent, or if the scent machines are just turned off for 4 or 5 days and I have to go buy more scent and create a new process, right? How do you deploy it? How do you become effective at it? That's what matters.
Yeah, man, I think lots of good stuff to unpack there. I do think consistency is key. I think first of all, if you don't already, you do need to have a written out system or checklist of what your patient experience should involve, all the different touch points that are there. And honestly, I like the idea of the secret shopper, and I think you could give that secret shopper your checklist. So like let's say you crafted a checklist of all the different important touch points at a new patient visit. Were you greeted with this saying and a smile when as soon as you walked in? Were you offered our cafe menu, our comfort menu? Did you get the things that you selected and asked for? Was your wait, how long was your wait time? Were you given an office tour as you went back? When you got to the room, what did one of the TVs have a welcome sign with your name on it? As you were seated in the chair, did someone offer to take your purse or coat or whatever you had and hang it up for you? One thing that we're implementing, I think a small touch, but we're getting phone chargers for every room. So that way, as patients go to sit down, they're asked, "Hey, would you like to charge your phone during your visit?" So that sometimes patients are there for a couple hours, and maybe sometimes they drove an hour. They may not have a charger in the car or whatever it is. You know how much of a bummer it is to leave someplace and have your phone dead, especially if you got more errands to run or whatever it is. So were you asked if you wanted to charge your phone during your visit? Um, as you were seated, were you encouraged to put something on Netflix? So one of the things that I try to coach my team on is not just asking patients if they'd like an amenity, but actually encouraging them to do it, because a lot of times people don't want to feel like they're being difficult or being an inconvenience. Hey, would you like me to go make you a cappuccino? Oh, no, that's okay. I can see you're busy, or whatever it is. So, sometimes same with the Netflix. I feel like a lot of times I hear the team say, "Hey, would you like to watch something on Netflix during your appointment?" Oh, no, I'm okay. At the same time, though, if that same team member goes and turns on the TV, goes to the Netflix button, opens a home screen, and says, "Here, find something that you want to watch," most people are going to find something to put something on. So, I do think that having the amenities is one thing, offering the amenities is another thing, but like actually encouraging patients to take advantage of your amenities kind of takes it to that next level. I'm going to go back to that experience at the Ritz-Carlton. As we walk up to the desk, it wasn't like to my wife, "Hey, would you like me to take that crinkled up water bottle that obviously is trash for you?" Where, my wife may have said like, "Oh no, it's okay. I got it. I know you're busy checking us in or whatever it is." It was like, "Here, let me take care of that for you. I'll go throw that away." So I do think that, it's important how we approach these subjects, just like really making sure that we're going above and beyond to create that customer experience that just completely wows our patients.
Well, I used to crazy fact about me. Listeners are probably like, Matt's done some crazy stuff in his life. I actually worked in fashion in New York City and high-end luxury in my early 20s. I worked for a watch company. Frank Mueller is my favorite brand, actually. Watches 15,000 to 1.5 million. And I kind of lived in the ultra luxury world for a few years, where like when I traveled was a lot of private, had a driver service, and that's kind of the way I lived for a few years. I lived in Hoboken, just outside the city. And when you're at that high end level, right? People aren't like, "Would you like a warmed blanket?" When you fly, like I flew first class to Qatar last year, Qatar Airways. Qatar Airways doesn't come along and say, "Would you like slippers?" They go, "Here, sir. Here are your slippers. Here is your blanket.
Yes.
Let me put.
Yep.
I'm gonna fold your bed flat for you now. Just give me a minute. I'm gonna put down
Yep.
your blanket." They don't ask you, "Would you like the experience?"
Yep.
What they do is they provide the level of experience, and that is really critical. And where it is critical, everyone's like, "Oh, well, we're dentists. We're not Qatar Airways or Dubai Airways." You're not. But what you are is you're the most feared medical provider in the world. Like, if you Google top 10 fears in America, dentist is on the freaking list.
Yep.
Okay? So listen, you're taking somebody who's terrified, whether they're presenting it to you or not. Nobody has no dental anxiety. There's just varying levels of dental anxiety, right? And whether they present it to you or not, it's there. I can tell you that the patient experience and providing it not asking for it to happen, not asking them to initiate it, but providing it will help with that anxiety and will make them come back more and more and make them feel more comfortable coming back. The worst thing in the world is when I go to practice in the morning and they look at a calendar and by 11 a.m. the whole day's falling apart. What I will tell you is my practices that have this level of experience, for some reason, whenever I visit, their day doesn't completely fall apart. Like one or two things fall off because people are motivated to come back.
Yeah. No, that I think you nailed it, Matt. It's such a subtle difference between would you like and here is your. But I do think it makes a huge difference because I can tell you there were times that I have been places where somebody asked if I wanted something, and in my head I thought about it, I'm like, I kind of do want that, but I kind of don't want to seem like an inconvenience or a pain or whatever it is. I've never once been upset that somebody was like, here's this complimentary thing or here's that. So no one's going to get mad at your team for doing that, but patients will appreciate the fact that, again, not only do you have these, but they're actually like being provided to them.
I'm going to put it real quick in an analogy, okay? So I fly a ton. Like I'm probably on an airplane twice a month, maybe once a month. I'm always on an airplane, right? If I got to fly a short flight from here to there, American Airlines, the little cart comes around and the lady's like, do you want to drink? Do you want crackers? Right? And I'm in my little chair and it sucks. Okay. I fly long distance international. The lady comes by and she says, warm towel. And she puts it on my hands. Do you want to be that? Or do you want to be American Airlines and be uncomfortable for 2 hours?
Right.
You're already in a dental chair. And listen, dental chairs are comfortable, but they're not a place of relaxation.
Yeah. Man, I would equate being at the dentist to being on a flight because I agree.
There's a level of discomfort that comes with it no matter what.
For most people, it is an uncomfortable experience that they don't really want to be at. But, you've got to be on the flight to go where you want to go. You've got to be at the dentist to make sure, that your teeth are in good shape or whatever it is. So I think even those small touches, think about being on an airline for a 2-hour flight and you've got a flat screen TV in the headrest in front of you with movies that you can watch versus nothing there. Just like sometimes like the small things can make a huge difference. And so that's why I think it's important to have those amenities, but even more important is your team, is their level of customer service, and is them actually making sure that your patients are taking advantage of the amenities that are there to make their visit more comfortable. We talked about consistency, guys. I think that's huge too. As we had mentioned, places like Ritz-Carlton, places like fine dining restaurants, like they strive to provide that same 5-star experience to every single customer every single time. And that's what we should be doing for our patients too. It's not okay to have an excuse of like, oh, we had an off day. Oh, the schedule was crazy. Oh, our front desk team member was having a bad week or whatever it is. Again, keep in mind, guys, as I tell my team, like we are performers at Disney World. We are there to be customer service experts, and we've got to do that day in and day out. And that goes back to our episode about morning huddle effectiveness. That's why it's so important that your whole team is there together to start the day on the same foot with that same mindset of we are here to serve our patients and we are here to provide that next level customer service, for our patients. Guys, this is so important to me that my flagship office is over 1,700 5-star reviews. Between my offices, we've got like 2,500 reviews, but we still put a major emphasis on this. We had a quarterly team Zoom meeting last month, and the main focus of the Zoom meeting was new patient experience. We're having our annual team-wide summit event here in September where we're renting out a conference room at a hotel, and we're going to spend the first half of the day just kind of in a big meeting with a few different talking points. But one of our major talking points, once again, is customer service, patient experience. So this is something that you can't just one time, write up a system of like, this is what our customer, experience looks like. This is what customer service is like at our office, and then let it go. This is something that you have to constantly be talking about. You need to make sure that your entire team knows how important it is to you. And then even once you've been doing it for a few years and you're getting all these great reviews, you need to keep doing it because guess what? that bar that was low for customer service in the medical field, you just set that bar way higher for your office. So now all the patients that are coming there, they're going to expect to keep getting that same experience. And guess what? You've had turnover, you've got new team members, you've got team members that maybe they've got other things going on in life, and things that were once important, are now forgotten. So make sure, throughout the year, multiple times, you guys are having meetings with your team, and you're talking about just what it means to have these experiences. Do the role playing, like Matt said. Pretend you're the patient and have different team members lead you through the office. See what it's like to experience that. Consider the idea of secret shopper patients. I honestly, I might implement that. I think that's a great idea. What's cool is, over the years, I've had different distant family members that my team may have not known were family, or friends come through the offices, and I'll get reports back from them about how their experience was. And usually it's great things I hear, but at the same time, like, if there's something that didn't go great, like, they're willing to tell me that, so that I can address the issue and make improvements. Because unfortunately, guys, a lot of times patients aren't going to tell you these things. Sometimes they'll leave a bad review. Sometimes maybe they'll send an email or something. But a lot of the times, if they had a subpar experience, they may say nothing, and they may just not come back. So you need to make sure you've got a finger on the pulse, and what your experience looks like. We talked about auditing the actual patient experience. You should also be auditing your facility. You should create a checklist of what every single area in your office should look like. And, you should have someone on your team, if not you, your office manager, somebody should be going through that checklist daily, weekly, whatever it is, to make sure that things still look good. Is the coffee bar pristine? Especially, we moved one of our offices, we moved our coffee bar out to the patient lounge area, to make some more room in the admin space, which I didn't love the idea, but it needed to happen. So now it is more crucial than ever that coffee bar is pristine every single day. Or if you've got like the toy machine, we've got toy machines for the kids with like little, you put the token in, we've got tooth tokens, but like, are they filled? I walked into the waiting room of one of our offices the other day, and I noticed that almost all the toy machines were completely empty. And I'm like, guys, like, we've got boxes of this stuff back there, but like, this isn't an inviting environment if you walk back there and you see these things are empty, or whatever it is. So like, there should be a standard of how your team is treating all the patients. There should be a standard of how your facilities look, and those things should be audited constantly and consistently to make sure that you are able to provide that 5-star experience. I know it sounds like a lot of work, and it kind of is, but at the end of the day, it's huge. Because if you create this Ritz-Carlton-like experience for your patients, it's going to increase patient retention. You're going to have less attrition. Even if that patient loses their insurance, or you stop taking their insurance, or they move farther away where now they've got a longer drive to your office, they are much more likely to keep coming back if you just absolutely blew their socks off with the patient experience. And if you do that consistently every time they come back, they are so much more likely to refer their family and friends. If you just have an average experience, I think it's okay, and you're convenient, so they're going to keep going to you. But their friend is asking for a dentist recommendation, they may not really want to recommend you. They may, it's okay. But like, we want to recommend things that we really love, that we're proud of, to our friends and family, because we want them to go have a great experience. So if your experience is on that next level, you better believe they're going to be excited to go tell their family and friends about your office and why they should, join as a patient. So to me, like, the most important thing in the success, in the growth of my dental group, and why we've been able to scale these startups so quickly, is because we put such an emphasis on customer service. And it's something that I continue to work on. I still don't think we're perfect. I still don't believe that we're the Ritz-Carlton of dentistry, and I still think that there are areas we can improve in. And that's why it's still a major focus for our team meetings and our company summit. That's why we celebrate the 5-star reviews every day at Morning Huddle. That's why myself, or my office managers, my operations manager, that's why we send messages in our group chat, WhatsApp chat with the whole company, celebrating these 5-star reviews. Like, we want to create a culture where it is so important to everyone within our organization that we are always providing that 5-star patient experience.
Going back to auditing the facility, right? When I say this is neglected, oh my gosh. I was at a practice, I had to have been about a year ago now, and I went in the bathroom, the patient bathroom, and it was bad. And I went to the doc. Doc, when was the last time you were in the patient bathroom? He goes, I can't remember the last time I was in there. I went in and showed him. And there was they had these glass shelves. It was covered in dust. There was toilet paper stacked up on the shelf, but someone took out the bottom toilet paper, stacked up like a triangle. And it was half done, and it was just bad. And he's like, yeah, this isn't good. I was like, you have a staff bathroom and a patient bathroom, and I bet you look at staff bathroom looks better. No BS when you look at staff bathroom. Staff bathroom looks better than the patient bathroom, right? And it was I was like, Doc, what's wrong here, man? He goes, yeah, docs think oh, these things don't actually equate to dollars. There's just extra work. No, these are the things that equate to dollars the most. I'm telling you, if I go into a practice bathroom as a patient and it's not awesome, I'm not sure if you're doing my dentistry. And, I talk about this in my case presentation training. When we present treatment in the operatory, that's 15 or 20 minutes or whatever it is, right? And the person doesn't accept treatment. In our minds, we analyze what happened in that operatory. We go, I said this, I did this, I thought everything went well. Why'd they say no? A patient can choose to not accept treatment long before they're ever in the operatory. And if you don't realize that everything from greeting to waiting room experience to trying to use that bathroom will affect what they say in the operatory to yes or no, you're crazy.
Yeah. No, I completely agree. I think that goes for, your patient lounge. I hate the term waiting room. I know it's a waiting room, but I like to call it the patient lounge. So
yeah, you're way better at those words and stuff than I am, because I say staff, you say team. I always mess that stuff up.
I think words matter. I think semantics matter. But anyways, the patient walks in, first thing they see is that patient lounge area. If you've got your coffee bar there and things are a mess and there's coffee beans and whatever on the floor, cups, on the floor, whatever it is, one, they're probably not going to want any of that coffee, but two, that's a bad impression for them. If the chairs are all strewn, the rug is old and dingy, whatever it is, they're starting to think if this is how they treat, this room, are their instruments clean? So, and then you go in the bathroom and the bathroom can be a horror show. Yeah, I agree with you, Matt. I think that's an easy way to lose a patient, lose out on treatment. So, you need to be auditing these things. Now, guys, I do want to talk about when things go wrong, because even at places like Ritz-Carlton, balls get dropped, things go wrong, reservations get double booked, whatever it is. So how do you handle those situations? Because that may be even more important than, all the other stuff that you're doing. You have, whenever something goes wrong, I look at it as an opportunity to make a bad situation into a good situation. So, first of all, my first role is to be proactive. And so I'm constantly talking to our team and our leadership team about being on the prowl and looking out for issues. If you see, and Open Dental will tell you how long a patient's been waiting since they checked in. It's in the little right-hand corner in the bottom. If you see a patient's been waiting for 20 minutes and nobody's gone over to them yet, and you're up front, you better think about being at a restaurant, as servers will go check on people, managers will come out and go check on people. Why do we just let our patients sit there? That is torture. There is nothing I hate more than sitting in a room and having the feeling of, did they forget about me? That is the absolute worst. You're seeing other people go back and you don't realize they have a hygiene appointment. You've got a doctor's appointment. Hygiene's running on time. The doctor's running about, whatever it is. But communication is so important, guys. Think about the difference between a patient sitting there for 20 minutes now it truly is a waiting room, and nobody going over and saying a single thing to them. They're just stewing. They're getting madder by the minute. Maybe they're not. Maybe they're on their phone and they're preoccupied. But if it's me, I'm getting mad. If I'm somewhere and I'm waiting and I'm looking at the time and nobody's coming over to me, I'm wondering they forget about me. I'm getting ready to go up to the front and be like, hey, did you guys forget about me? Am I still going back there? Now think about that versus patients sitting there and maybe you have a set time in your office. Maybe it's 10 minutes past their appointment time or whatever it is. Now someone goes back there and says, hey, John, I wanted to come back and apologize. we strive to run on time for every single appointment. We value your time and we hate to waste it. Unfortunately, it's been one of those days and the schedule did fall behind. So first of all, I want to apologize. I want to let you know that we are doing everything we can to get you back there as soon as possible. It looks like we should have a room ready for you in about 5 to 10 minutes, so it won't be that much longer of a wait. And for the inconvenience, I'd like to buy your next coffee, or we'd like to buy your next coffee. And then you hand them a $5 Starbucks gift card. $5. That's it. But like the difference between those two situations can be the difference between a patient being mad and thinking this is the last time I come to this office, or maybe even leaving without telling anybody, and being like, oh man, they really care. They care about me. They care about my time. And they've made a statement that this is not how they run their office and this is not acceptable to them. They let me know how much longer it's going to be. So I'm not sitting here thinking it might be another 45 minutes or whatever. Now, don't tell them it's going to be 5-10 minutes if it's going to be 45, because then you're just going to make them even madder. But, they've communicated how much longer the wait's going to be. And then, they gave me a gift card to Starbucks. They wanted to buy my next coffee for the inconvenience. Like, that is such a 180 from that first situation. And I'll tell you what, at that point in time, that patient's probably not even mad that there was a wait, and they're probably even a bigger fan of your office. So being proactive makes all the difference in the world. Go buy little $5 Starbucks gift cards or whatever you want to get them for. The amount of money doesn't matter. It's the thought of the gesture and the fact that you are letting them know that their time is important to you and that you want to make up for the fact that you've inconvenienced them. We also, if it's a bigger mess up, we'll do a $50 office credit. So like, let's say a lab case was late or something like that, and the patient took off work and showed up and we didn't find out in time. And we basically, they drove over there for nothing. We wasted their time. All like my office managers all know they can give a $50 office credit. Now it's not a $50 gift card. It's not a hard cost. It's credit they can use towards future treatment or whatever. But again, it's us letting them know, hey, we value your time. We dropped the ball here and we're going to do something to make up for it. We coached our team recently on effective apologizing or effective apologies. And this kind of all goes into what we've just been talking about. So the 3 steps to an effective apology when something goes wrong in your office, the first step is to take accountability or ownership. So, whoever's talking to the patient, whether it's you, your office manager, your front desk personnel, somebody is going over to that patient and they're saying, hey, we are taking accountability. We dropped the ball here, and we're sorry about that. The second step is to show empathy and let the patient know how you'd feel. I hate it when I go somewhere and I have a long wait, especially if it's going to make me late for my next appointment. We never want to do that. We value your time just as much as you value ours. And then the third step is to offer a solution. And now buying their next coffee, the $50 credit, that's half a solution. That's like, hey, we want to make up for this. But the other half of the solution is like, how are you going to prevent this problem in the future? So for instance, as far as balls being dropped, this is probably the biggest area we have of opportunity for improvement, because our offices are busy and sometimes, despite our best efforts, the schedule does fall behind. But this is a situation that does arise sometimes, and especially on Tuesday evenings at my flagship office, we're open till 7:00. It is like the busiest time of the week, and so if there's any time we're going to run behind, it's often that time. So my team is trying to tell patients like, hey, I don't want this to happen to you again. I will let you know, like, Tuesday evenings are our most popular time. It's in high demand. Everyone's trying to get into this time. Sometimes appointments do get a little bit crowded at this point. Would it be easier for you for your next appointment if we scheduled an early morning so you come in first thing? Those appointment times are much less likely to have any additional waits or anything like that. So you're offering different solutions, so that the problem doesn't happen again. Again, the 3-step effective apology is so much different than your team members come up and being like, I'm sorry. Hey, I'm sorry we were late. I'm sorry you had to wait.
It's annoying when you just say sorry, 'cause it's like, yeah, I bet you are. Like, I waited an hour. I bet you are sorry. When we have problems at my company, I always start off with like, I own it, and I say, all right, well, what I want to do is I want you to tell me. 'Cause ours is a little bit more complicated than being late going back to a dental chair, right? I always say, tell me everything that went wrong in your experience. I want to hear everything, and no one's going to interrupt you until you say you're done talking. So make sure you're heard.
Yep.
And then I address each concern individually and tell them how it's going to improve. Similar, more complex service, a little harder, but similar. People don't want to just hear sorry.
Yeah.
That's not going to cut it. And if you're trying to do the Ritz-Carlton standard, Ritz-Carlton doesn't just say sorry either. They comp you a room, or they
Oh my
you know what I
gosh.
mean? Like Ritz-Carlton doesn't say sorry. They make
Yep.
it right. There's a difference between saying sorry and making it right.
So I think, there's a couple things that go into this. First of all, the examples I'm talking about here where your team is being proactive. So basically, there's a saying like the first person to talk loses. I think when it comes to apologies and, when it comes to trying to prevent problems, the first person to talk is going to win. So, if your team is proactive and they address the elephant in the room before the patient does, it's so much easier to get a positive result. If they don't address it and the patient has to come up to the team member, the office manager, whatever it is, and say, hey, this just happened, I'm not happy. I still think you can fix the problem with an effective apology, owning the situation, having empathy, offering solutions, like what can I do to make this right? But I think it's a lot harder. You've got a much steeper hill to climb if you're not proactive and if you're not the first one to address the issue.
Yeah. And we have to wrap this up. Real key indicator is if you're the practice personnel or practice team member, and you have an awkward feeling coming from a failure with a patient, that is your sign to now be proactive.
Yeah. You've got to read body language, guys. Absolutely, 100%.
Listen to your body, read body language. If you're like, man, this is getting awkward, that is it. It's time to become proactive. If you become reactive, you're going to lose that patient or have a bad Google review. Listen to your body, read their body language. If you feel awkward and things are awkward, it's time to navigate the human terrain and be the proactive party. 100%. So we have to wrap this up, guys. Hey, this was a really awesome episode. Something me and Andrew really feel passionately about. We kind of rehash it from different points of view every so often because we think it's that critical. Guys, please click like, click subscribe, click follow, leave us positive reviews. We don't bombard you with sponsor ads or anything else. It's just me and Andrew, and it's what we see that's effective, and we're trying to deliver it to you. Most people pay thousands of dollars for consulting for stuff like this. We just try to put the information out there for the betterment of the community. Thank you so much for listening, guys. Have a wonderful day, and have a great 2022.